Whether you're a farmer, factory worker, or a businessman, knee pain is a problem that it affects millions, especially those over the age of 50. While knee replacement surgery was once invasive and often painful and required extended rehabilitation for the patient, modern medicine and new technologies in the past few years have reduced the risk, the pain, and the recovery time. So joining us this morning, Dr. William Kurtz, an orthopedic surgeon based right here in Nashville, Tennessee, and also one of his patients, Rick Binkley. Thank you so much for joining us this morning. We appreciate it.
Thank you.
So let's get right to it. Let's talk a little bit about, what we have in front of us today, if you wanted to kind of discuss a little bit about what you do and your involvement with your patient here.
Sure. So I do orthopedic surgery. I am specifically hip and knee replacements, and this is a model of a knee replacement. And the knee replacements have come a long way in the last few years. We now can basically take a 3D scan of a patient's body and make an implant that is specialized just for that patient. So the shape of the implant matches the patient perfectly.
That's amazing. Let's talk about your surgery you had and kind of some of the things you'd like to share with us today.
Well, I had both knees replaced in November, and I've always been very active, and I had become to a point where I could not be active. And I had both knees replaced by Dr. Kurtz with a conformist knee, and 6 months, and I'm playing golf and doing anything that I want to do now.
Gosh, that's amazing. Let's talk kind of about where we were and where we are today with surgeries like this, and kind of maybe some of the misconceptions that you'd like to address.
Sure. So we've been doing knee replacements, the orthopedic community, for about 50 years. The first knee replacement came in one shape, one size, and every 5 or 10 years we make advancements, and each advancement has gotten us closer to the normal anatomy of a knee joint. And now we have a knee joint that is actually the perfect representation of what that patient's anatomy was. So nowadays the surgery is so much easier than it was even 5 or 10 years ago. We do patients that go home the same day. Outpatient knee replacements are fairly common now. The recovery is much easier. So the knee replacement your mom or grandparents may have had is not the same knee replacement that patients are getting today.
All right, we were seeing here that according to the American Medical Association, it's estimated, is it more than 600,000 people, they have knee replacement surgery every year, is that right?
And that number is going to go up 7-fold, so it's projected to be 3 million in about 15 years.
Wow, that's amazing. Let's turn it back to you for a little bit here. I mean, getting the surgery, I'm sure it was it's a scary process. It's something I'm sure that, a lot of people, they really, it's not something you look forward to, that's for sure. And it's maybe some people that are tuning in this morning. Do you want to kind of address some misconceptions as well? Tell us about your journey through this.
Absolutely. I'd heard horror stories from people years ago who had knee surgery and all the pain and all that was involved. 22 hours after I had both knees replaced, I went home. And a day or so after that, I was in physical therapy, and my journey back to active again had began. I just would like to say to anyone who is not getting this done because of the fear, go for it. It's been a blessing for me.
Any advice other than that either one of you want to share about this whole process?
Well, I think picking a facility and a surgeon who does a lot of knee replacements is very helpful and important. So you want to make sure you have a good team that's going to be doing your process, your surgery. And then having a motivated patient doing the physical therapy afterwards is very important. So having the right attitude helps.
Amen. That's right. Well, relaying it to our viewers, we have a lot of farmers that tune in, a lot of rural-based viewers tuning in right now. Let's talk about kind of that type of work. Do you see a lot of ag businessmen and women as your patients?
Yeah, and actually I love operating on farmers because they're the best patients, because they're tough. They're really tough individuals, and they're used to working really hard throughout their entire life, so they are not afraid of a little hard work in the physical therapy afterwards.
Wonderful. Anything else you want to share about the surgery and any more information?
Surgery takes about an hour for a knee replacement, so it's not as long and complicated of a process as people probably have it envisioned in their mind.
Wonderful. Where's your practice located?
Here in Nashville.
Right here in Nashville. Right. Wonderful. And one more question too. How kind of has the technology changed? I mean, I'm sure you've seen some amazing things throughout your career.
So the customized implant is basically a 3D printed model of that patient's knee. So all the implants are 3D printed. So all the manufacturing is customized, the whole implant and all the tools that we need to do that surgery come shipped in a box, a little FedEx box, and that is really revolutionized how we can get patients through the system.
Wonderful. My goodness. Well, we really appreciate both of you taking the time to talk a little bit more about this with us. It's nice to hear, the advancements that have been made, and sometimes it just takes someone updating us and telling us about them, so it's not such a scary process. Wonderful. Well, we appreciate you both joining us here on our Market Day Report. If you'd like some more information about knee replacement surgery, we do have the information. It's under our links section on our website, rfdtv.com, so you guys can head there if you'd like to know more. All right, well, keeping an eye on your Memorial Day weekend forecast, meteorologist Joe King is in next.